Let's move forward to the next critical step. Before you actually punch the holes on the dam sheet, it's very important to decide exactly where those holes should be located. And this positioning really makes all the difference when you are applying the dam to the patient's mouth. So let's start with the maxillary teeth. So whenever you are isolating the teeth in the maxilla, the first holes we mark are always for the central incisors. And here is a golden rule. Those holes should be placed about 1 inch or 25 millimeters from the superior border of your dam sheet. So this is the superior border of the dam sheet. So the holes that are to be placed should be about 1 inch from the superior border of the rubber dam sheet. Now, why do we leave this much space? Because this 1 inch gap ensures that there is enough material to comfortably cover the patient's upper lip. If the patient has a large upper lip, then you have to leave a little more than an inch. On the other hand, if you are working on a child or an adult who has a smaller upper lip, then you can place the holes little closer, that is slightly less than an inch. Once you have marked the central incisors, simply continue to mark and punch the rest of the holes relative to that reference point. Now, when it comes to the mandibular teeth, the approach changes slightly. So here, the very first hole you mark is for the anchor tooth, the one that will carry the clamp or the retainer. And this is where your clinical judgment comes in, especially if you are not using a template, stamp, or the teeth themselves as a guide. In that case, you will need to rely on the mental grid system. Here is how you do it. Imagine dividing the rubber dam sheet into 3 vertical sections, left, middle, and right sections, and into 2 horizontal sections, upper and lower. So now you have got a mental grid, left, middle, right, and top and bottom. Let's say you are isolating 3/6 with a clamp. That's on the lower right side. So you will mark your hole at the intersection of the right vertical third and the middle horizontal lines. This places the hole exactly where it should be to fit the tooth and still leave enough dam around it. And now, if the anchor tooth is 4/6, the principle is same, except the hole shifts slightly towards the left vertical third following the natural arch form. If you are clamping a second or third molar like 3/7, 3/8 or 4/7 or 4/8, then the position changes. Compared to the first molar, the hole needs to drop slightly downward towards the inferior border and also move little more towards the center. And why like that? Because the farther back you go, the more dam material you need to pull over the upper lip and behind the retainer. So for the mandibular first premolar, the moment is opposite. Here, the hole should be placed more towards the superior border of the sheet and slightly more central compared with the molar position. For the mandibular second premolar, the position is quite similar to the first premolar, just a little less exaggerated, still closer to the superior edge, but a bit nearer to the dividing line. So, to put it very simply, the farther back you go, like second and third molars, the hole goes downwards and central. The farther forward you go, like premolars, the hole goes upwards and central. That's the overall pattern to remember. Until you are not comfortable fully with all these positioning rules, don't hesitate to use aids like template, rubber dam stamp, or the teeth as a direct guide. So the one which I have explained right now is a freehand method. You can always have the alternatives for punching the holes, like you can use the teeth as a guide. So this is very useful for malaligned teeth. So you can hold the dam over the patient's teeth or a stone cast using the teeth as a guide and mark the position of the teeth. It is accurate, but it takes a little time. And if you are using the patient directly, you can only do this once they are seated. Using a rubber dam stamp. It is commercially available and your assistant can even prepare multiple sheets in advance.